Cerebral ischemia, a cause of fall in older adults. Falls are a major problem for older adults and a leading cause of injury, disability, and decreased quality of life. While aging naturally brings physical and cognitive changes that increase the risk of falls, the role of cerebral ischemia, a condition in which the brain does not receive enough blood, has become a concern. Cerebral ischemia can cause symptoms such as dizziness, lightheadedness, and impaired motor coordination, all of which increase the risk of falls. Understanding cerebral ischemia and its effect on fall risk. Cerebral ischemia occurs when blood flow to a part of the brain is restricted or reduced, resulting in a lack of oxygen. The brain is highly sensitive to oxygen levels, and even brief interruptions can impair cognitive and motor function. For older adults, these interruptions can stem from conditions such as atherosclerosis, where plaque in the arteries reduces blood flow, or from heart problems such as arrhythmias, which disrupt a constant blood supply. The link between cerebral ischemia and falls lies in how ischemia affects brain function. Inadequate oxygen supply can lead to transient ischemic attacks, often called mini-strokes, which cause sudden, brief symptoms such as numbness, dizziness, or weakness. Not only are transient ischemic attacks dangerous in themselves, they can also cause a person to lose balance and lead to an immediate fall. Studies have shown that older adults who have experienced a transient ischemic attack or other forms of cerebral ischemia are at increased risk for falls due to the sudden onset of symptoms. Cerebral ischemia can manifest as a variety of symptoms that directly affect a person's balance and spatial awareness. Dizziness and lightheadedness. Dizziness is a common result of low blood flow to the brain and can affect spatial perception, making it difficult for a person to stand or walk safely. Older adults who feel dizzy are often unable to react quickly to disturbances in balance. Motor weakness and numbness. Ischemia can cause temporary motor weakness, especially on one side of the body. This one-sided weakness can make a person unsteady on their feet, increasing their risk of falling. Vision changes. Blurred or double vision due to restricted blood flow to the visual processing center of the brain can further impair balance and spatial awareness, making it difficult for a person to navigate obstacles or accurately judge distances. Cognitive impairment. Cerebral ischemia may temporarily affect cognitive abilities, leading to confusion, disorientation, and slower reaction times. For older adults, even brief cognitive lapses can cause them to forget to use a walker or misjudge their steps. These symptoms suggest that cerebral ischemia is a significant factor in falls in older adults. However, it is important to understand that cerebral ischemia alone does not explain the entire risk profile. Falls are often the result of multiple factors, each of which requires targeted intervention. In addition to cerebral ischemia, there are various other factors that contribute to the high rate of falls in the elderly. Age-related physical changes. Aging brings natural changes that affect balance, flexibility, and strength. Muscle atrophy, or the gradual loss of muscle mass, is common in older adults and directly affects their ability to maintain stability and recover from sudden movements. Decreased joint mobility, especially in the ankles and knees, can also limit balance reactions, making falls more difficult. Reflexes slow with age, meaning that older adults may have delayed responses to disturbances in balance, even minor ones. For example, an uneven sidewalk or a minor bump can challenge the body's reflexes. While a younger person would react quickly to correct, an older person may not react as quickly, resulting in a fall. Medical conditions and chronic diseases. In addition to cerebral ischemia, many older adults suffer from chronic diseases that affect their stability. Joint pain and stiffness caused by arthritis can change gait patterns and make balance difficult. The tremors, stiffness, and slow movements characteristic of Parkinson's disease can severely impair balance and coordination. Osteoporosis can increase the harm caused by falls, which adds another layer of risk because patients may fear exercise, leading to a loss of muscle mass, further increasing the risk of falls. Cardiovascular disease, diabetes, and high blood pressure can also lead to balance problems, further increasing the risk of falls, either through direct effects on circulation or as a side effect of medications. Side effects of medications. Polypharmacy, the use of multiple medications at the same time, is common among older adults. Many medications, such as blood pressure medications, sedatives, and antidepressants, have side effects such as dizziness, drowsiness, and impaired coordination. Interactions between medications can also increase the risk of falls. For example, blood pressure medications can cause orthostatic hypotension, a significant drop in blood pressure when standing, leading to dizziness and possible falls. Sedatives or sleep aids may make people feel groggy, especially in the morning, another peak time for falls. Environmental risk factors for falls. The physical environment has an impact on the risk of falls in older adults. For example, homes with poor lighting, cluttered sidewalks, or loose carpeting present many tripping hazards. Bathrooms with slippery surfaces and a lack of handrails are particularly high-risk areas. Installing handrails, grab bars and anti-slip mats, as well as ensuring walkways are clear and well lit, are effective measures to reduce these environmental risks.